have to numb the area. I have to use a needle and insert it in the area and anesthetize the area.
I'm gonna just put a little numbing right here, okay?
There's a lot of bumps on Diane. So it's a messy process, it's a very long, drawn-out process, and it could be a painful process.
My name is Diane. I am 63 years old. I have bumps on my skin, thousands of them, all over. This condition is called neurofibromatosis.
Oh! Neurofibromatosis, otherwise known as von Recklinghausen's disease, is a genetic disorder where you develop tumors or growths on nerves. These tumors can occur on the skin like she has, but they can also occur in your brain and in your spinal cord as well.
It is painful because it's the nerves coming through the fibroids of your skin, and it pushes out. And they get on the outer layer of your skin. If you scrape them, it can cause a very bad infection, and it can really do some damage.
These neurofibromas can be quite painful. As you can see, she's got so many of them. And unfortunately, there is no cure for neurofibromatosis. Now, you can remove some of these lesions, but as you can see, there are so many of them. That is a big challenge. Which ones do you take out? Which ones do you leave?
This skin condition has really robbed me of my self-esteem because I am so tired of people looking at me strangely.
That is one of the worst parts of having neurofibromatosis, is the fact that you can't control what part of your body they show up on, and quite often they do show up on the face, which you really can't hide. There are other things that can occur with neurofibromatosis. Patients can get scoliosis, where you get a curvature of the spine. There is a very high incidence of learning disabilities, possibly related to tumors that can occur in your brain, actually. And you can get tumors on the optic nerve, which can even impact your vision.
You look at other people having all these joyous moments, and then you have nothing that you wanted in your life. Some doctors will say, well, you know, they'll grow back, and they might grow back worse. And that terrifies me. And it stopped me from a long time doing anything about it. This condition, it just robs you of everything.
Such a tough position for her, because this is not anything of her doing. She didn't do anything to get neurofibromatosis, but obviously she is suffering from it in so many ways. Now, there are two characters in history who were rumored to have had and suffered from neurofibromatosis. The Elephant Man, John Merrick, was believed to have had neurofibromatosis, but was later found or determined to have Proteus syndrome instead. And the other character in history who was really ridiculed and treated super poorly, that is rumored to have had neurofibromatosis, is Quasimodo, the Hunchback of Notre Dame.
My brother and I live together. Ernie has a condition similar to mine, but his is a little worse. At times, I have a hard time looking at Ernie because it reminds me of me.
Neurofibromatosis is a genetic disorder, and it's basically a mutation on the 17th chromosome. Now, we all have pairs of chromosomes too. We get one from each parent. And because it's considered autosomal dominant, that means that if one parent gives it to you on that chromosome they give you, then you are going to get neurofibromatosis. And so it's basically a 50-50 shot. Now, some people suffer from neurofibromatosis with absolutely no family history of it, and it's believed that those patients have had a mutation in that gene causing the neurofibromatosis.
Hi, how are you? Are you Diane?
Yes, I am.
Hi, Diane. I'm Sandra. It's very nice to meet you. Welcome. You're so beautiful right now. This color looks great on you.
Thank you. I have some neurofibromatosis.
Okay.
And they're bothering me on my stomach.
Okay.
And I was thinking about getting something done to smooth out my face.
Okay.
Now, if you're Diane and you're a patient and you're sitting there waiting for your dermatologist, to have Dr. Lee walk in, where she's so kind, she's I mean, so professional, yet she's got such bedside manner. I mean, you gotta hand it to Dr. Lee. I just love her.
The goal here is to try to really remove, whether shave excision or trying to use a laser to smoothen out these bumps on her so she looks less bumpy, so she looks less different than everybody else.
Because neurofibromatosis is a genetic disorder, there is no cure for it. And the only thing that we can do is treat the symptoms, which is basically remove each of these individual tumors. Well, she's got so many of them, that is a big challenge here.
Okay, so let me get them numb a little bit. For every bump that I have to remove on Diane, I have to numb the area. I have to use a needle and insert it in the area and anesthetize the area.
I can just put a little numbing right here, okay?
There's a lot of bumps on Diane. So it's a messy process, it's a very long, drawn-out process, and it could be a painful process.
Okay, so this is where, as a board-certified plastic surgeon, I would do this a bit differently. Instead of doing it under a local anesthetic in my office, I would actually bring Diane to the operating room, put her under a general anesthetic so she's completely asleep, and I would just start lopping away at these babies, taking them off one by one super quickly. The benefit of doing it under a general anesthetic is, number one, she's not going to have any pain from it, which is so helpful for her. And number two, hopefully I could remove a lot more than I might do under a local. To do it under a local, you have a limit to how much local anesthetic that you can inject before somebody has anesthetic-related complications and toxicity. Under a general anesthetic, I could just be cutting these babies off, having my PA, my surgical PA, helping me with putting sutures in, and hopefully get rid of a ton of these. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
So what I'm gonna do is use these special scissors that are serrated. They have a little bit of a serrations, like a knife that would have serrations in them, so they grip you more.
It was really surprising just how much that hurt. In fact, even more than I expected.
That is so satisfying. Just take a pair of scissors and cut it off. Pair of scissors, cut it off, cut it off, cut it off. So satisfying.
I've removed a lot of Diane's neurofibromas, and I'm trying to concentrate on the ones that really irritate her the most, the ones that she's reminded of the most. I do worry that the things that I do for Diane aren't going to help her as much as I wish I could, because I can't cure this.
And that's the hard part about treating somebody with neurofibromatosis, is that you can help by removing certain ones, as many as you can, but in the end, more are going to pop up. And especially in Diane's case, where there are so many of them and her body is just creating so many of these tumors, you know, you can get rid of what you can, and hopefully that's enough to help her feel better about herself.
Just trying to shave some of them down so they're more flush with the skin.
I think the advantage to using a scalpel, a very sharp blade on her face, is more of the precision that I get. I can probably more precisely remove tissue in this instance, and I want to be very precise on her face. I want to make sure that I get the best results possible.
And I would agree with Dr. Lee here. Using a pair of scissors is very quick, and you could just lop these off very quickly, whereas using a scalpel blade, you can have much more precision, but it does take longer amounts of time.
I'm using this laser to tighten the skin around here, and also to kind of sand down the surface so that we don't have as much bumpiness. We're trying to even it out like you do with fine sandpaper. Okay, good. All right, good. Let's stop right there and just turn to the other side.
Dr. Lee is using a fractional ablative laser. And that's a fancy long term for basically burning the skin, but instead of burning the whole surface of the skin, you're burning tiny columns into the skin, which allow the collagen to tighten up to give you actually tighter, smoother skin afterwards.
All right, sweetie, you did awesome.
Wasn't too bad.
Here, I'm gonna take these off of you. Take a look here, sweetie. If you look real carefully,
Yeah.
see the little dots? So
Yeah.
those areas will kind of peel first. We're gonna put some antibiotic ointment on you. It's gonna look good. There,
Yeah, that's
okay?
awesome.
But it's gonna look good.
That's so awesome.
When you have your face lasered like this, it does have to heal for a while. And so it does look like you've got a burn there. You can get a little bit of oozing sometimes from it. And the antibiotic ointment is meant to help to moisturize the skin and provide an occlusive barrier to allow your skin to heal and to epithelialize for new skin cells to basically heal what was essentially a wound that you created with the laser.
I've been wanting those off for such a long time, and she's done a lot for me today. Wow, that's a lot. There's a lot of them. Looking forward to having the confidence in myself once again. I'm so happy.
That is impressive how many of those neurofibromas she took off under a local anesthetic in one office visit. Now you may look at Diane and say, oh my gosh, she really does not look good, which is true, her chin does not look good, but it actually is supposed to look this way after you have all this done. And I bet that she's gonna look really, really good once she is all healed.
This was all bumpy, now it's smoother here. It's been about a month since I've seen Dr. Lee, and I am feeling good. She removed a lot of the neurofibroids, and people do notice I had something done. That's good. It's been worth it because it's giving me some self-esteem, which I didn't have any. Thank you, Dr. Lee. I thank you. And I'm gonna cry because she's giving me back some self-esteem. And she's giving me some hope, and I thank her for that.
What a sweet woman Diane is to go through those difficulties with neurofibromatosis and to have the attitude that she has. She's just so, so inspiring. In plastic surgery and dermatology, I mean, we're not necessarily saving lives every day, but to be able to help just to improve the quality of life for someone like Diane means absolutely everything. Well, if you like Diane's transformation, you're going to love this next one. I reacted to a video from Dr. Pimple Popper of a patient with rhinophyma, excessive overgrowth of the sebaceous glands of the nose. It is impressive. Click right up here to check it out. And always remember to eat real food, use clean skincare, and always consider plastic surgery as a last resort.